Surgical hand washing requires the removal and killing of transient microorganisms and substantial reduction and suppuration of the resident flora of the surgical team for the duration of the operations. In case a surgical glove is punctured or torn, ensures that fingernails are kept short and clean. Good day everyone! I am Nurse Shaina and I am going to perform surgical hand washing. This is done to remove transient microorganisms from the nails, hands, and forearms. Remove any watches and rings from your hands. Ensure that your sleeves end at least 2 to 3 inches above your elbows. Roll your sleeves up if necessary.
For the procedure, I will remove any watches and rings from my hand.
Jewelry harbors microorganisms and prevent the patient from receiving a possible burn from the current from electrocautery. Before beginning the scrubbing process, open your gown and gloves using a septic technique and ensure they remain sterile.
We use a septic technique in opening the gown and gloves to prevent contaminating our hands after surgical scrub.
It is to not contaminate hands after surgical scrub. Packages of gloves and gowns are considered unsterile. Wash your hands with regular soap to remove any gross debris. Rinse your hands by keeping them elevated and let the water run down to your elbows.
Wash your hands with regular soap to remove any gross debris and keep your hands elevated while rinsing in a running water.
It is to remove bacteria and oils on hand. Remove scrub brush from the package and use nail cleaner to clean the fingers.
The use of the nail cleaner is to remove debris and transient microorganisms from the nails, hands, and forearms.
It is to remove debris and transient microorganisms from the nails, hand, and forearm.
Squeeze scrub brush under water to release soap from sponge.
With the scrub brush perpendicular to fingers, begin to scrub all four sides of each fingers with back and forth motion.
We need to scrub each sides of our fingers, hands, and wrists to inhibit the rapid rebound growth of microorganisms.
It is to reduce the resident microbial count to a minimum and inhibit rapid rebound growth of microorganisms.
Scrub dorsal and palm surfaces of hand and wrist with a circular motion. Starting at the wrist, scrub all four sides at the arm to the elbow. Transfer scrub brush to the other hand and repeat steps 6 to 8. Discard scrub brush and rinse hands and arms starting with the fingertips and working toward the elbows.
It is to prevent from dripping from fingertips. Allow contaminated water to drip off the elbows by keeping hands above the wrist.
Keep our hands above our wrist to allow the contaminated water to drain.
To drain or flush bacteria, and keep fingers elevated to maintain sterility of hands after scrubbing. Dry with the sterile towel. Using care not to let the towel touch anything, take the top of the towel and pat one hand before arm dry. Carefully take the bottom of the towel and pat dry your other hand and forearm.
Sterile towel is a 100% cotton that are fully disposable and can be used in drying our hands and forearm after hand scrubbing.
Drying facilitates donning or putting on gloves.